Hello and welcome to the Homoeopathy. In this present video, we are going to discuss about Polycystic Ovarian Disease. It is a very common condition affecting 5 to 10% of women in age group 12 to 45 years. So, as the name suggests, poly means many. That means many or multiple cysts are present in the ovaries, which are accompanied by a group of symptoms. Now we shall further go to the exact definition of PCOD. PCOD is the number of symptoms on account of heightened androgens in females. It refers to the condition when a woman has a number of small cysts in the ovaries. It is a heterogeneous multisystem disorder of female during reproductive age. Let us now ponder upon the incidence of PCOD. It affects 5 to 6% of women due to some stress or lifestyle change. Nearly 20% of infertile women suffers from it. Also, women who have some cardiovascular disease, type 2 diabetes mellitus or endometrial cancer have an increased chance of developing PCOD. Let us now throw some light on the causes of it. The cause of PCOD isn't well understood, but may involve a combination of genetic and environmental factors. Doctors believe that some of the women have the predisposition to it, and that it may also run in the family, while it may also be linked to or worsened by the exposures at the time of prenatal period, epigenetic aspects, ecological effects, along with the growing levels of obesity. Pathogenesis of PCOD. Obesity causes adipose tissue to secrete leptin, adiponectin, and cytokinin, which interferes with the insulin signaling pathway in liver and muscles, resulting into insulin resistance, hence hyperinsulinaemia. Increased LH causes infertility or miscarriage, which causes increased proliferation of theca cells and produce increased androgens, decreased SHBG, and increased testosterone, which results into hirsutism. Pathologically, the findings are enlarged ovaries, multiple cysts, usually 12 or more, at periphery or surface of ovary, and necklace-like appearance in ultrasonography. Whenever the patient visits the doctor, she might have following symptoms, that is, irregular periods, heavy bleeding, hirsutism, acanthosis nigricans, that is, darkening of skin, infertility, etc. If PCOD is left untreated, there might be some complications like difficulty in conceiving, type 2 or gestational diabetes mellitus, high blood pressure, heart disease, or uterine cancer. It is the leading cause of infertility. There are a number of investigations to find out whether the patient is suffering from PCOD or not, and they are ultrasonography, hormonal assay, TFT, and laparoscopy. The ways to treat PCOD homeopathically are: first, graphites. In this, the menses are too scanty, pale, with violent colic. It is irregular in nature and are delayed from getting feet wet. There is morning sickness during menstruation, and the patient is very weak and prostrated. Second, thuja. The menses are scanty and retarded. There is ovaritis, which is worse on the left side at every menstrual period. There is profuse perspiration before menses. The vagina is very sensitive, and there is severe pain in left ovary and left inguinal region. Third, apis. Menses are suppressed with cerebral and head symptoms, which is especially seen in young girls. This painful menses with severe ovarian pains, which is worse in right ovary. There's soreness and stinging pains and great tenderness in abdomen over uterine region. Fourth, calcarea carb. Before menses, there's headache, colic, chilliness, and leukorrhea. There's cutting pains in uterus during menstruation. The menses are too early, too profuse, too long, with vertigo, toothache, and cold, clamp feet. There's burning and itching of parts before and after menses in little girls. So, after this, there's dietary modification of PCOD. There's always a question of what or what not to eat when a person suffers from PCOD. So, a diet should include more of fruits and vegetables, lean meat like fish. The person should drink lots and lots of water and take natural herbs. The breakfast should include fruits with multigrain bread with tomato and cucumber in it. One should avoid dairy-based products, red meat, saturated fat, sugary foods and drinks. Here's the list of food items that can be included in the diet. For example, cereals like quinoa, oats, etc. Pulses, nuts, fruits and vegetables. Apart from the diet, there are some yoga exercises that a woman should do on daily basis to keep herself fit and healthy. Some of them are Bhujangasana, Naukasana, Dhanurasana, Balasana, etc. With this, we end this topic. Thank you so much for watching. But before going, don't forget to hit the like button and subscribe our channel. Keep supporting and loving us. Thank you.